I've been getting lots of comments and messages like these where they canceled my appointment because they ran out, and messages like FYI, the one CVS that has Moderna has canceled all appointments, saying they aren't authorized and won't administer shots irrespective of insurance, and that the other CVS won't have it until October. He said they haven't received instructions on administering the shots, which is the issue now. Mixing and matching, it makes no sense. And we are starting to get some answers to these 2 points, such as in this article here. So first, let's talk about the Bridge program. The end of the public health emergency kicked off millions of people from their health insurance, and the CDC, because of this, started the Bridge Access Program, which temporarily provides vaccines to the uninsured using $1.1 billion of leftover pandemic emergency funds. The first issue is because of the quadruple price upcharging and the lack of the government putting a price cap on the return for their investment in funding the development of these mRNA vaccines. This high price is reducing the total number of shots that the government can provide through this program. Next, we have this article here, where it states that most medical providers are not currently ordering vaccines for their patients, in large part due to the uncertainty of cost reimbursement from the insurance companies, and that they hope to provide the vaccines to their patients once reimbursement rules are amended, which happens after the FDA approval. So in theory, part of the issue is that these insurance reimbursement rules have not been set for some insurance providers. And at Health Community Services, they aren't sure if they're going to be able to provide these vaccination clinics because they are not an in-network provider for any insurance. So clinics like that, that operate outside of the traditional medical billing system, would have to purchase all the vaccines at their own expense, where they would anticipate to have to spend over $100 per dose on the vaccine, on top of the expense of running mass vaccination clinics, which includes ensuring they have qualified professionals, supplies, safe administration space for the vaccine, and renting out the space itself. And that until they can secure funding for the vaccine, all of their mass clinic plans are on hold indefinitely. And for the Bridge Access Program, they anticipate they will receive a very limited supply of COVID vaccines through the Vaccines for Child and Vaccines for Adult programs, where they re-emphasize that, again, supplies will be very limited. They anticipate that the pediatric vaccines they receive will be available for children 5 to 18 years. When they're available for younger children, we will be able to provide the vaccine for them as well. And that while they are in this uncertain transition period, they're hopeful that amended insurance agreements with medical provider organizations will enable more local entities to provide vaccines for their patients in the future. And then we have this article here where thousands of people claim their COVID-19 booster shot appointment was canceled, where in a statement by CVS, some payers or insurance companies are still updating their systems and may not yet be set up to cover the updated COVID-19 vaccines. If this happens, our pharmacy teams can help patients schedule an appointment for a later date. And then there's this article here, patients charge hundreds amid Bumpy rollout for new COVID-19 shots, where Glenn Cote of Acton was driving to his CVS appointment and was shocked to receive a text minutes before the appointment letting him know that the vaccine would cost $190.99. Where CVS and the Centers for Medicare and Medicaid Services, the new vaccines have a new billing code for insurances, which has not been updated in all insurance plans, leading to the erroneous charge for people seeking out a vaccine in this first week. So all of this ramble to ultimately say that you're not alone in these experiences, it seems to boil down to a few things. One, that insurers have updated their codes, and these need to be updated within their systems before they can cover it for each person. Two, if a place is out of network, then they're going to have to pay out of pocket, so they're not actually buying them. Three, limited supplies due to the high cost of the vaccines themselves is going to make it so that people have limited supplies for adults and children, and that these might come at a later date than previously expected because of that. And that's all the reasons we know for now. So if your appointment gets canceled, persevere, reschedule the appointment, and try again. I apologize that happened to you, but be persistent. It's very frustrating that it's happening, and this shouldn't be happening, but it is. So please keep persevering. You got this. I believe in you.